Well, hello, everybody. Welcome to our podcast, Diabetically Speaking with Smart Move 360. And welcome back for those who are already following us for a while. I am Irina Strunina. I am hosting those series every Thursday. We go live at 4 p.m. Eastern Time. I invite different healthcare professionals who are helping me to look at different angles of life with diabetes. It's for those who already were diagnosed, or maybe your family members is diagnosed, or maybe you know that you have a potential to get diagnosed in the future and you would like to avoid this situation. So this is the place for you, the place to learn, the place to connect, to see what is available, how you can be helpful, how you can help yourself. And today I have my good friend. She's not the first time on the podcast. So we are meeting with her regularly in person and on Zoom. Dr. Dolapo Babalola, please welcome and tell us about yourself.
Yes, thank you so much. It's always a honor and pleasure to be in be on your platform and just be with you. So thanks for the invitation. So as mentioned, I am Dolapo Babalola. I am a family physician in the East Cobb Marietta area. I'm also the owner of Life Wellness, which is a membership-based, holistic and integrative direct primary care practice. So as mentioned, as a family doctor, I do provide full spectrum primary care services. I love that I'm a one-stop shop. So I do my pap smears. I can take care of acute, chronic, even urgent care, small minor injuries. So I cover all of that and all ages. So I say from cradle to cane. So that's who I am. I focus on lifestyle, whole person approach. So I'm certified in lifestyle and obesity medicine. So that's a summary of who I am. I'm also the physician walk leader for the Walk with a Doc, which is a global, international, and nonprofit organization where we build healthy communities through movement and conversation. So that's a nutshell of who I am. Thank you again for inviting me to your platform.
Perfect. Thank you, Dr. Bobs. And I am also the member of that chapter. We are meeting in person every
Yes.
month to do a little walk. It's my opportunity to see and meet with people and connect with other healthcare providers as well as with people who have some goals to achieve in their physical condition. Some people have just a goal to be walking more often, and the other ones have different goals, anyways.
Yeah.
And the reason why I really wanted to talk with Dr. Bobs is exactly what she described. Right now, we are in the season of making a decision for next year. The new healthcare plans are coming up, the new agreements you need to sign up for the next coming year. And sometimes we realize that the plan that we were signed up for last year didn't work as well as we were hoping for. Sometimes we are not sure that we want to continue to work with this group, with this doctor specifically, and it's always very hard to make a decision. What exactly do I need? We all want to be taken care of if some
Yeah.
emergency happens, but we also would like to have a physician who will help us with our those minor issues. And not always doctors who work in big insurance network are available. Sometimes you need to wait for months to have an appointment. And that's why I thought that Dr. Bob's, with her practice and the way how it's structured, will be a good option to know about. I'm not saying that everybody has to do that. Maybe you have an insurance perfect plan from your employer, and that's fine. But if you need to make those decisions every year and never heard about this is information that may help you to make the decision when the time comes. So let's go to there. Can you please tell us what does it mean, membership-based um, medical services? How does it work?
Yes, yes. So anytime I have an opportunity to share about direct primary care is always a good day. So let me share exactly what a membership-based practice means. So it's under the umbrella of direct primary care. So just to break it down a little bit, in the healthcare system, we have the traditional healthcare system, which is governed by insurance run. It's insurance driven. I know that very well because I was in it for 16 years after residency. So when it's insurance driven, as good as it is, unfortunately, it doesn't take care of primary care needs. So you're good to, acute visits, just the minor things or major things that you might have. Because it's insurance driven, the focus there is more of the quantity and how many patients are seen versus the quality of care. So in that system, the traditional healthcare system where it's governed by insurance, you don't get to dictate when you see your how soon you can see your doctor, when you get in, how long you spend with your doctor. That is the traditional healthcare system. What it's best for is emergency situations, so like a heart attack or surgery. Now, shift that to membership based, which is direct primary care, is a different model, which is not governed by insurance. So it's an innovative alternative way to insurance driven health care. So we focus on well care versus sick care. And what does that mean? It just means your contract is with your physician, right? So physician to patient contract, you pay a membership fees, which is flat fees once a month. You have access, unlimited access whenever you need, just like you alluded to already, Arena. You said when you want to get in, can you get in right away? Do you have to wait 3 months? Unfortunately, in the traditional healthcare system, you will wait. I had a patient just last week said she had a lump in her breast. Can I be seen? Yes, I got her in as quick as possible that same day at 2. In the other system, you would wait 3 months. As soon as we diagnosed what was the issue, we're able to get her in as soon as possible to get an emergency mammogram and ultrasound. So in the DPC, it's like Netflix of medicine, right? If you have a
Mhm.
Netflix account, you whenever you want to watch your program, if you wake up in the middle of the night or if you were during the day, you have access, unlimited access. So that's the same way with DPC model. And we have doctors all over the country where their goal is to prioritize patients' care and make it patient-centered. So that's a summary of what it is. It's just a contract with your physician, regardless of whether you have insurance or not. Your doctor is caring for you, has a contract with you once a month, unlimited visit, whenever it is that you need, you get the care that you well deserve.
So you're saying that since it's a flat fee there, flat fee, there is
Yes.
no deductible, no extra maximum out of pocket, all those settings that people
Yeah,
often have, and they consider, do I go to the doctor or this will be the whole deductible on top
I
of everything that
know.
I'm paying monthly, and they skip those visits.
Yes, absolutely. You hit the nail on the head. And more than that, too, it's transparent, right? So you know what you're paying once a month. It's not shifting. Have you ever had that bill where several months later you have a bill and
Yeah.
it says, and you're like, oh, did I go to the emergency room? Yes. And then you have this big bill. Even though you paid your copay, even though you met your deductible, you still get a bill. So with DPC, there's no such thing. It's a flat fees. You pay that. Every month it gets deducted and you get the care that you need. So you don't have to meet a deductible. You don't have to pay a copay when you come to the doctor. So if you do the math, let's say, with diabetes, which of course we know that Irina does a fantastic job in her group. If you have diabetes and you need follow-up or you need refills, every time you're going to the doctor, you're paying a copay for that. Well,
Yes.
with DPC, you're not paying a copay. It's that you've already paid that once a month, no matter how many times, whether you text your doctor, you call your doctor. My patient last week sent me a text at 6 p.m. I have a rash. It's hurting so bad. I think this might be shingles. We got on telly very quickly. I saw it. Yes, that's what it is. Sent prescription to the pharmacy. So there's no need. I save them the time in the emergency room, save them the time in the urgent care, whatever it is. And they didn't have to pay a copay, right? They didn't have to. So that's what you get, transparency. You get immediate care. You don't have to be worried about whether you've met your deductible or not, if your doctor will see you. Nothing like that. And you have all the different platforms, whether you need to come in person, a phone call, a text with your doctor. It just makes it accessible, affordable, and within the appropriate time that is needed.
Yeah. What about, say, do you work somehow with the emergency situations? Do you have a network that is related that you can refer, or people need to purchase a separate emergency plan? How does that work?
Yeah, so that's a great question. So with DPC, direct primary care, we take
Mm-hmm.
care of your primary care needs, right? So acute, as I mentioned, urgent. So if it's a cold, a urinary tract infection, if you need your pap smears, whatever procedures, minor office procedures, like I do toenail remover, I do wart, if you have a wart, I take care of that. So all the primary
Blood
care needs,
work?
refills, warth, like
I know I'm saying blood work. Do you do the
Oh,
blood
yes.
work?
Yeah. So we do blood work as well. So blood work is for DPC practices because we understand the value of being cost effective. We do stock medications and it's discounted to our patients because we get it wholesale price. So I
Mm-hmm.
had a patient and I gave a 90-day supply for $2.
Oh,
And then
wow.
blood work is also discounted, which is so amazing. When I had insurance, my blood work, even though they told me it was going to be covered, I got a bill close to 1,000. I could not believe it.
I
And
cannot
in
believe it.
my own practice here,
Yes.
that same six comprehensive labs is $40. I called them. I
Wow.
said, you know what? Just forget that I have insurance. Can you please tell me your self-pay price? Well, it was 188. Of course, there was nothing I could do. I had to pay for it,
Yes.
but that's not going to happen to me next time. I'm going to my own blood. My whole blood work is discounted at 40 because we have discounts with LabCorp and Quest to make it affordable because they understand the model, right? We don't have the
Mm-hmm.
insurance. Now, of course, some of our patients, they do have insurance and they say, you know what? I know for a fact that my insurance is going to cover my labs. Then we'll bill it to insurance, right?
Yes.
But to answer your question in terms of emergency, yes, if it's an emergency situation, which we do not take care of, right? So we take
Mm-hmm.
care of 90%, but the 10 that I don't take care of, like if it's an emergency heart attack, a pulmonary embolism, any of those emergency things that are beyond what we can do in the primary care clinic,
Yes.
we do network with doctors that can provide that coverage. It can come in two ways, either a catastrophic insurance, right, which will
Mm-hmm.
kick in for those emergencies, or health shares. So that's also another option. For people that are hearing about health shares for the first time, it's pretty much, kind of, they say it's not insurance, but it's a network where you pay into it, where if anything, God forbid, say happens, then it kicks in to provide you that emergency care. So there's so many health shares that are available, but when you work with a DPC doctor, what we find is that you're not delaying going to the doctor because you're afraid of meeting your deductibles. You're in touch with them. So they keep you well. So we minimize you going to the doctor. We keep you well, right? But we can't predict accidents and all those other
Yes.
things. And if that does happen because you either have a catastrophic insurance or you have an insurance that is affordable for your family or a health share, then that will cover it. But the good news is that your doctor works in tune with whoever, whether it's the hospital or the emergency room. I had a patient that was admitted at Northside. He was able to call me while he was in the hospital. I was able to talk to the doctor while he was there because you have that relationship with your doctor, which you don't get in the traditional healthcare system. I was in it. I had a 3,000 patient panel. Patients couldn't get to me as much as I even wanted to because it
Mm-hmm.
was all about how many patients we were going to see. There was so many paperwork processes. So that's really the difference between the two. But it's a great question you ask, and people ask it all the time. What happens for all those other things? Another question that comes up, and you're probably going to ask, is about referrals, right?
Yes.
So as a DPC doctor, am I able to refer my patients to a cardiologist, to an endocrinologist? Yes, I am able to do so. There's no problems there. I just put in the referral, ask the doctor how do they want the referral made, and then we connect with them. We establish that continuity of care. Now, if depending on what's going on as a primary care doctor, I can care for diabetes, I can care for hypertension. So we're not referring out to every single person like
Yes.
you would see in the traditional healthcare system. When I had 12 minutes, everything got referred out because there was not enough time for me to sit with you and
Exactly.
talk about what's going on. But now my appointments are 1 hour, an
Uh-huh.
hour, 60 minutes to 90 minutes, so I can get to the root cause. We can take care of your blood pressure. I don't have to be sending you so many places where, I mean, you don't have time to go to multiple doctors, right? Your primary care doctor is well equipped to take care of those things. And of course, if it's needed that we need to reach out to a specialist, like I have somebody I'm sending to a cardiologist,
Yes.
then we connect with cardiologists and we make sure that your care is well coordinated instead of so many doctors that don't talk to each other and the patient is stuck in the middle trying to figure out what exactly is going on with them.
But when you refer to a specialist,
Yes.
like cardiologist, for example, how goes the relationships with that cardiologist go if I don't have that cardiologist anyhow in my, I don't
In
know,
your neck. Yeah,
anywhere?
so we work with our patients because again, it's always about patient-centered care. That's, I can't emphasize it enough. It's patient-centered care. Whenever I have patients, I ask them, based if they have insurance, because I do have a few patients that have insurance and they understand the value of having a choice to pick their doctor,
Mm-hmm.
right, when they can see them. So, and they don't want it changing all the time. Like you said, every
Yes,
year you have to, if you change jobs, then you have to change your doctor and start all
yes,
over again. A lot of doctors are not taking new patients. The system
yes.
is just really, really competent, right? Very confusing and complex. So people prefer, yes, I have insurance, but I want to have the right to be able to pick the doctor I want. Now, to your question, for the patient that I'm sending cardiologist, depending on their insurance, right? Insurance is so complex. So sometimes they might not have doctors out of network. We do have our doctors that are self-pay, that are
Uh-huh.
specialists. But if they want to rely on their insurance, then we have to make sure we send them to a doctor that is within their insurance. But the
Mm-hmm.
good news is that either way, whether it's within our own network of doctors that are self-pay or what is covered by your insurance, we keep that communication open. Like at my practice, whenever I send my patients to a specialist, somebody to an orthopedics just a few weeks ago, we ask them for the report, right? We want to know what was done so that we can, coordinate that care with our patients. So no loop is left open. We want to make sure
Mm-hmm.
that our patients, get the care that they need. And if there are any unanswered questions, we're here as their primary care doctor to fill those gaps for them.
Absolutely. Well, this is all very good information to know because
Yeah.
I know that between my friends and people who I am communicating with,
Mhm.
very few know
Yeah.
about the option that you are
Mhm.
giving us a description.
Mhm.
And I know that the new word started reappearing again as a concierge doctor. Can we consider
Yeah.
that as a concierge doctor or not?
Well, we like to pride ourselves as being different from concierge doctor, and the reason is because the care is the same. It's still personalized care. But
Mm-hmm.
the difference, I say, and it's known out there, that we are more cost effective.
Okay.
Okay, so a concierge medicine doctor, I call it celebrity doctor because their
Okay.
price is really high. You're
All
paying
right.
close to 250 to 500 a month.
Oh, wow.
Some people paying 5,000 a year. I know that's a lot for me. And we want to make DPC cost effective. So when I say DPC prices, it's anywhere, at least my price is 59 for children if they sign up with a parent a month.
Mm-hmm.
That's so
Okay.
cost effective.
Wow.
And if you don't sign up with a parent, I do have a few between 2 and 17 that didn't sign up with a parent. They're 79 a month.
That's
79 a month. Now, for
amazing.
my anyone 18 to 40, less than 40 years old, so 18 to 39 is $99 a month. And I say life begins at 40. So if you're
Yes.
40 years old, it's 119. The highest DPC price that I've seen is 150 a month. Now, when we talk about concierge medicine, you do the research. They
Yes.
go from 250, 350 a month. And
Mm-hmm.
another difference between DPC and concierge is that concierge double dips. So they would still bill your insurance, but they would also take a membership fees, and you could be paying a copay.
Okay.
You could be paying a copay. So that's why I like to differentiate it. Again, the care is still personalized. You still have access when you need and all of that. but you decide, do you want to pay that amount of money, versus the other? Meanwhile, so that's really what I like to always emphasize, that there is a difference in terms of the cost, and not so much the delivery, but certainly the
Mm-hmm.
cost. Yeah.
Mm-hmm. Well, that's a good information to have. Now I have another question. I
Okay.
know that you are very well educated, that you has had 16 years experience in working in this huge hospital that we have here in
Yeah.
Atlanta with multiple not options, but kinds of care that doctors need
Hmm.
to provide people of
Yes.
different walks of life, different situations, and all
Hmm.
this. Uh, do you know the people in your network, in DPC network? Are they all well-educated doctors, or who is coming to this network?
Oh, lovely. Great question. Yes, these are doctors that are so passionate about healthcare. These are doctors that went into medicine to care for patients and got frustrated with the system. These
Okay.
are doctors that still want to practice medicine and decided to get out of the traditional healthcare system. So, yes, they are fully educated. Just life generally, we're all supposed to be lifelong learners, right? So I love how you remember you came as a guest and you spoke so well from your heart, and people were still calling me, telling me how they were so blessed by what you taught them. You remember you talked about the calf just to, use the muscle. So these doctors, we're constantly learning, improving, right? So I am a family doctor. I got boarded in lifestyle medicine, obesity medicine, because what they taught us in medical school is not enough to take care of our patients where we are at this moment. We have doctors, women's health. So I've got additional training in women's health.
Mhm.
All these doctors I'm talking to you, they have done additional training just to be equipped to take care of our patients. So we're no longer telling people, "Oh, just exercise and eat better." No.
Yeah.
What are we missing that we didn't get in medical school? So yes, I love the DPC doctors because we're constantly improving on our knowledge. How can we help our patients? How can we serve them better? And the DPC model, it actually has an alliance. It's called DPC Alliance, and we attend once a year. So people go twice just so that we can educate ourselves and improve on the care that we provide. So anyone in the DPC forum, it's called DPC Mapper, and
Mhm.
I'll put that link
Yeah.
later on so that you can refer back to it. Every state has a doctor that is considered a DPC doctor, direct primary care doctor. So you can find one. And the good news about it too is that these doctors majority of them provide a complimentary meet and greet. Like I do. I want to get
Uh-huh.
to know you before, and I want you to be comfortable, right? Because there are
Yes.
questions, right?
Yes.
So we offer a complimentary meet and greet on Zoom, on the phone, to ask questions. What are your goals? What are your expectations? And then we share about our practice. A lot of them have questions about, is this a contract? Am I bound to you? Oh, and another thing I forgot to mention
Uh-huh.
is with concierge medicine, you pay for the whole year. So I don't
Yeah.
know who has 5,000 sitting to pay for a whole year. And I don't know what their contract is. If you say you don't like it anymore, I think you're stuck for the whole year. But with DPC, it's a service agreement. It's a 30-day cancellation notice. You're not stuck. We just pay monthly, month by month.
Mhm.
So with the DPC, again, it's just to understand if it's a good fit. If it's a good fit, it's a good fit. And if it isn't, like you said, some people are happy with their insurance. Okay, fine. If that's good, if that's working for you, stay with it. But if you feel like you really want to have a relationship with your doctor and you want them to know what's going on with you. I had one of my patients send me a picture. She climbed Kilimanjaro and
Yeah.
she sent me a picture, and I was so proud of her. So if you feel like you need that attention and you don't want to be rushed, then need a DPC doctor. It's affordable. My monthly fees, the amount people are paying in premium for insurance, is for 1 month. You would even cover that in a year with my own, and then you get better care and easy access.
Absolutely. And I know that a lot of my friends who have insurance from work and they have to put some money from their,
Yeah,
they pay much more
yeah,
in a month
yes.
on the insurance plan that is provided,
By
basically
work.
forced on them by
Mm,
their employers. So
Yeah.
yes,
Yeah.
it's absolutely a great
Mhm.
alternative, and I'm
Mhm.
so happy that you had time to meet with me today
Yeah.
and talk about it. As I said, it's a time when a lot of people
Yeah.
have to revisit their
Mhm.
plans, their
Yeah.
insurance providers, because I also know that a lot of doctors they change their network, and someone who
Yes.
you used to work with all of a sudden is
Yes.
not in your network, and you are have to find somebody else. So great information. Thank you, Dr.
Thank you.
Bobs.
Thank you for
So
having me.
well, absolutely. And before we part today, let me do a quick housekeeping. I usually at the end of our show, I'm reminding people about different activities that are going on in our Facebook group, Diabetes 101 for Beginners. So on Tuesdays, we have Telenurse Tuesdays. This is when one of the registered nurses is getting online and answering questions, but they are answering questions in writing. So you don't need to be on Zoom to ask this question. You don't need to wait for her to show up to ask this question. Just type it under the banner that we post in the group, and the questions will be answered. Every other Wednesday, we have support group meetings. We meet in Zoom, not in a Facebook group, so you will need to get a link that I usually post in the group announcements. It's at 7 p.m. Eastern Time every other Wednesday, not every Wednesday. On Thursday, of course, we have our podcast, Diabetically Speaking with Smart Move 360. We go online at 4 p.m. Eastern Time, but of course, I have links. I have YouTube channel. I have the other places where I collect those videos, and you could go ahead and binge watch all our almost 80 episodes already that we have in the last 2 years. On Friday, we have Fitness Fridays with our own Trevor Brown, where he goes online at about 9 a.m. Eastern and talks about different ways how you could support your body with the movement, what activities you can implement. Sometimes he also puts in the information about some nutrition because he is also working with life-based solutions where they provide the nutritional information as well. And of course, it's October right now, and I wanted everyone to remember that on the last Saturday of October, on October 26th, we will have our next 16th Diabetic Healthcare Expo. And by the way, Dr. Bob's is going to be one of our speakers there, so keep it in your calendar and don't forget to log in. So, with that, we are wrapping up today. One more time, thank you very much for joining me for this recording, for this meeting. I will put under the video in the
Okay.
comment section information about the network that you are talking about, so
Mhm.
everybody could go ahead, check for themselves. This is in most states in the United States.
Yes.
So
Yes. Yes.
you don't have to live in Georgia to have a doctor that can help you the same way.
That's
And
right.
let's see what else we can help you with. Please don't hesitate to comment, to ask questions. We will be here to answer them for you. With that, thank you very much. See
Thank
you
you.
next Thursday. And that's it.